Okay. Now continuing forward, on each side of the clivus, I told you that there is a fissure, this one which I am marking. This fissure is known as petro-occipital fissure. Petro because of the petrous part of temporal bone, and occipit because of this occipital bone clivus. So at the junction of the petro and occipit we have petro-occipital fissure. This petro-occipital fissure leads to a foramen. Foramen is any hole in a bone. This foramen is known as jugular foramen, which hole of this in which I am marking my pen. See, it is like this area. Now in this jugular foramen, in upper portion we have slight notch, this one which I am marking with my pen, this notch. See, this notch is known as glossopharyngeal notch. You must remember name of this notch and this foramen, it is very important. This is jugular foramen and this notch is glossopharyngeal notch. After that, this is the raised area. See, like this, if I put the bone here, this is the jugular foramen and this is a raised area here which is known as jugular tubercle. On both the sides we have these things, jugular tubercle here and jugular tubercle here, jugular foramen here and petro-occipital fissure here. After that, I have a small opening in below this jugular tubercle, like this, where I am putting my pen. It is not very much clearly visible. There, opening here just below the jugular tubercle. This is known as hypoglossal canal and it leads outside to the external acoustic meatus. See, like this. No, not this one leads. We have this internal acoustic meatus here, this one opening just above the jugular foramen. It leads outside to the external acoustic meatus, not this one hypoglossal canal. Hypoglossal canal is just a canal just below the jugular tubercle. So these openings are in the order in such a way that first of all internal acoustic meatus, which leads outside to the external acoustic meatus. After that jugular foramen having glossopharyngeal notch. After that jugular tubercle, and after that hypoglossal canal. Very simple. In the center we have the clivus. In the middle portion we have the jugular foramen. Internal we have this internal occipital crest, internal occipital protuberance, transverse sulcus and sigmoid sulcus. These are the fossa, occipital fossa, deep occipital fossa. And here just a thing which is remaining is that we have subarcuate fossa, internal acoustic meatus just lateral to it. See, this is the internal acoustic meatus, this opening in which my pen is inside, this opening, and just lateral to it here, this fossa is known as subarcuate fossa. See, now this is the complete posterior cranial fossa. All the features are explained almost. If you have any query related to it, you can ask. Thank you.